Jersey. I'm a hearing instrument specialist, which actually 14 years ago this week I started this great venture where I get to help and change people's lives every single day. Not many professions you can see the immediate results of that, but when people come in here and they tell me they're not hearing their grandchildren, they're mumbling, the spouse is always have to repeat herself or himself. But then when you get to show them there's an easy solution for that that doesn't require a lot of intervention. So I'm here to explain a little bit about what hearing is, what hearing loss is, and what we can do about it. Most people hear and they think, oh, for my age, I'm hearing okay. My philosophy is for any age you should be hearing well, whether it's 50, whether it's 120. We advise most people at age 55 and up to start getting a hearing evaluation. That's where we're going to start noticing you're not hearing the sounds as well. Common comment is, oh, I hear, I just don't understand. Well, that's what hearing loss really is. In our cochlea, or in our ear, we have 25,000 nerve endings. And when we're 20 years old, we're hearing perfectly. It's great. Those nerve endings are taking down background noise, bringing speech up. We can hear in a bar, on the phone. But as we get older, and that starts at age 20, our body starts decaying a bit. And 25,000 nerve cells start decaying as well. Noise exposure, medications can cause a lot of that. But also the aging process. So age 55, we request everybody, we really recommend get a free baseline hearing test at any hearing aid center you may have around you. They're going to do a simple test, if you can screen over here. They're going to see where you hear different frequencies at what volume. Low frequency is on this end, high is at this range. High is women's voices and children's voices, and unfortunately that's the first that we lose. So we want to hear our wives, we want to hear our grandchildren. But those nerve endings, those sensors are the ones that start decaying. And then we miss a word like sheep or cheap, cheese, chief. All those high frequency sounds get distorted and we're not really sure what's being said. We read lips, which we all do because the brain wants to know what's being said. We try to figure the content of the sentence. Go to the store and get some cheese. Well, he didn't say go to the store and get some Chiefs. So we figure it's cheese, but our brain did not get that signal. There's many studies now linking cognitive decline with hearing loss, because what's happening is the brain's not being stimulated like it was, so the brain's forgetting the sounds. And that has led to many studies showing that hearing loss untreated has a higher risk of Alzheimer's, dementia, depression, balance issues, memory issues. Not saying hearing loss is going to be guaranteed you're going to have these conditions, but there's a high rate of connectivity to it. Also, when someone gets hearing help, their cognitive abilities symptoms come back a little bit, not a lot. But it's important to get a baseline hearing test when things are good. People say all the time to me, Michael, I hear fine. Great. That's when you get a baseline hearing test. If you come to me, which most people do, and say, well, I haven't heard clearly in 5 years, or honestly, the wife usually says he hasn't heard well in 10 years, that means you're missing out on some of those sounds. Not only neurologically are you missing out, but you're missing out on the family connections. You're not hearing your grandkids tell that great story of what happened in school. And you accuse them of mumbling. You know, hey, Johnny, talk slower. You're mumbling. But it's generally not Johnny who's mumbling or talking fast. It's us who are not hearing their sounds clearly anymore. Again, we hear them, we don't understand them. And that's two parts of hearing and understanding. Most people won't come and get a hearing test because, as I tell my patients, I'm not going to tell you anything you don't know already. They know they have a hearing loss. And they're afraid of what that means because a lot of times it means mortality. They don't want to face that, quote unquote, I'm getting older. But what's great about the hearing test is we can catch things early, and you don't have to wait till it's that bad, like we remember our grandparents doing. That's why a lot of people shy away from it. The hearing test takes about 15 minutes where we do a tone test. You hear the tones a certain volume. Speech, I want to know how well your brain's still understanding what I'm saying and how well it's processing what I'm saying at what volume level. We generally speak about 50, 60 decibels. In the booth, I'll ask you, how do you hear my voice? You'll say comfortable. Well, that may be at 80 decibels or 90 decibels. Well, we can't speak that loud without getting a headache, without getting a sore throat, and without sounding like we're shouting at each other. Again, what people tell me is, my wife's always yelling at me. Well, yeah, because you're not able to hear till it's much louder. But that affects the relationship between the two of you, and that's not good. When I was starting out, my kids would ask me, how do I tell people what you do for a living? They don't want to tell people how to look in people's ears. I said, I help calm families down. And that's what it does. We take away one barrier to a relationship of communication, which is vital. If we're not communicating our thoughts well, we're arguing about what we're saying is we're putting a barrier to that relationship. So the hearing test takes about 15 minutes. We also test to make sure nothing medical is going on. Maybe you have wax. We check the ears for that. Maybe there's some fluid or pressure in the middle ear. This time of year, at least in Jersey, we're experiencing high allergy season. So people are congested. They feel stuffed up. Well, that's going to block your hearing too. I had a patient today that came in and I said, look, let's test you in July when your allergies are cleared up, because that's going to give me a false reading. But if there's no medical condition that's blocking it, allergies, then and you have a hearing loss, which not everybody has, if you have a hearing loss, then it's very important to do a demonstration of what a hearing aid could sound like. I can't tell you what a car is going to feel like to drive, and I can't tell you what a hearing aid is going to sound like to wear it. So we do a little demonstration, which is very important. Any place you go, you should ask them to let you listen to what a hearing aid sounds like. When we do a word test with a spouse, a loved one, without a hearing aid and with a hearing aid. And then you'll say, wow, that's a big improvement. Or there's no improvement. If there's no improvement, then a hearing aid's not recommended. But if there was a big improvement, then we can discuss what we can do. And the next stage is kind of shock for someone who really didn't think they heard poorly. But most of the times it's, yeah, I knew I wasn't hearing well. And wow, I can hear your voice a lot better. One gentleman told his wife, I forgot how beautiful your voice sounded. She cried, he cried, I cried. So that's a beautiful moment because I can break down that barrier and get them just communicating once again. Then the next step is, well, I don't want anything big. What do these hearing aids look like? Because people remember hearing aids looking like this. Big, we call them bananas behind the ear. Well, these are older type, and some people do require these, but most don't. People want to get really small ones that can't be seen. Not always the best option, but we have that option. What's great right now is you probably don't even notice I'm wearing a hearing aid because they make the hearing aids discreet. No one wants to be blaring that I'm wearing them, and they want them to be comfortable. So if you look, I'm going to take out the hearing aid that I'm wearing, and I'm going to put it back in my ear and do a little magic trick and make it disappear. Goes behind my ear like a pair of glasses, in my ear, and like that, it's gone again. We want people to be comfortable. We want people to feel good about it. But more importantly, we want them to be hearing clearly again. And we've taken down those barriers of fit and comfort. The new brand just came out. Nice, sleek style. Really thin. We're trying to knock down again those objections that people have. Most people say the biggest reason I don't get hearing aids is cost. But that's not the reason. That's the first excuse. Because once we start discussing what hearing aids can do for you, then the real objections come up. Vanity, number one. Then comfort, number two. Everyone benefits and appreciates the hearing aid once they get it. And they hear the sounds of life again. They hear the birds chirping. They hear their footsteps. They hear the air conditioner go on. And those are all sounds that give us what's going on around us and give us sounds of life again. People forget there's crickets outside. They forget the jingling of the car keys or the turn signal, which everyone always yells at their spouse about. But the biggest step is that free baseline test. Let's get past that. Let's get acknowledging what our hearing is and what our hearing is not, and then do something about it. That's the biggest message I want to give to people and to tell their loved ones. Get baseline hearing tests. Most places give a free test or it's covered under insurance. But go to a professional hearing center. That's my biggest advice for you. A lot of people will ask me, why everybody hate their hearing aids? All my friends don't like the hearing aids. Well, first of all, most people, if they're happy, don't tell you about it. We're creatures of telling people what's wrong. I hate that hotel. I hate that restaurant. They can eat in the same restaurant 20 times in a row, but they're not going to tell you, wow, 19 times it was spot on great. Did I tell you the one time it wasn't? Well, most people do like their hearing aids and hear better. Why do some people not like their hearing aids? One, they waited too long to get them. So now we're playing catch up. I can't help you if you're waited 10, 20 years to get a hearing aid when you really needed one 20 years ago. Someone who has a bad knee, who's told by the doctor, get a knee replacement, I'm going to wait 5 or 6 years. Well, guess what? You're not going to be as mobile in 5 or 6 years as you could have been then. Same with the hearing. We're working with the brain, we're working with the cognitive ability. So the earlier people get it, the better they do. Second is, get hearing aids that match your lifestyle. My analogy is if you have to pull a tractor or a wagon, you're not going to use a bicycle. So don't get inexpensive ones just because they're inexpensive. Make sure it has the features that meet your lifestyle. The new technology is incredible. It lowers background noise. It brings up speech. Everyone has problems hearing in a restaurant. Everyone has problems hearing in a family meal. So what the hearing aids do, actually, they lower that murmur and they bring up the speech quickly with artificial intelligence, fast processing. I'm not an engineer. I don't get it. To me, it's all magic. But thankfully, the smart people who design these do get it, do understand acoustics, and they work really well. Are they better than they were 3 years ago? Absolutely. Are they better than they were 10 years ago? It's like going from black and white TV to the high definition TV of today. Will they be better in 5 years? Absolutely. But don't wait until they keep getting better, because every year they're going to get better. You can help the brain today hear clearly and process properly and enjoy life again. Enjoy the grandkids' stories. One story, I keep going back to this, a woman came in crying, and I thought she was upset about her hearing aids. I said, Ms. Jones, what's going on? Everything all right? She was, I drive my grandson home from school every day, and he always tells me what happens from back of the car, and I have no idea what he's saying, and I just yes him. Today, for the first time, I heard his story, and I started crying, and she had to come in and tell us right away. That's powerful. That's impactful. That's what we need to do, take back our lives that way. Get rid of the ego, get rid of the vanity issues, and really address it. Another concern we have is, especially with COVID and with cancer treatment that people go through, is a lot of medication, a lot of medical treatments can affect your hearing loss. But if we don't have a baseline to show what it was before we got sick or change our medications, we don't know what caused it. So again, we tell people, if you unfortunately diagnosed with cancer, get a baseline hearing test, because treatment can affect your hearing. I use the word can a lot because everyone's different. Everyone's body's made differently. But medication, there's over 200 medications that can cause hearing loss. Well, your doctor puts you on new medication, it can affect the nerves in your ear and change the hearing. So the baseline is so important, why you reiterate that over and over and over again. We get baseline tests for everything else. We go to the dentist once a year to make sure our teeth are good. We go to the eye doctor, but people neglect the hearing. Another thing people want to address is, how is hearing health related to overall health? Well, a lot of conditions can affect your hearing. I talked about medication, cancer treatment. People have diabetes, people who smoke, heart condition, kidney disease. These are all, people have an elevated risk of hearing loss. And then the other side is, if you have hearing loss and don't treat it, then you have health-related issues like cognitive ability, balance issue, depression, because you're socially isolating yourself, which is never good, especially during COVID. We learned, don't stay home, we gotta get out and be social again. We saw a huge influx of people come in right after COVID saying, I'm never going through that again. I'm doing everything I can. But now it's been about 1.5 years, 2 years, and people are getting complacent again. You also have the risk of Alzheimer's and dementia being higher for people who have hearing loss who didn't treat it. Again, disclaimer, it's no guarantee if you get hearing aids you won't develop it, but you know what, you give yourself a fighting chance. And that's bringing more people in to see people like me, because they're saying, you know what, I'm not waiting, I'm gonna get help now. And then they benefit and say, wow, I didn't realize the crickets were outside, I didn't realize I hear my grandkids. Whatever the reasons, we have to knock down some of the frightening things that are associated with hearing aids. They're aids, they're there to help you. We may have some questions that have come in, I can answer.
So one of the questions is, how do I know I need a hearing test?
Okay, you know you need a hearing test if you're 55. That's a baseline. But more importantly, if you're noticing that, or people are noticing that you're saying what more, if you're mixing up words like chief and cheese, your wife says, go to the store and get some cheese, You get to the store and you're like, she said get some chi, because the S sound is that high frequency that people are missing. Then you come home and say, I forgot what you asked me to get. You didn't forget, you never heard it clearly to begin with. So 55 and up, and I joke that I want ID from every woman who comes in here that says she's over 55. But that's how you know you hear it. Your family, loved ones, mainly women and children, will say, you're not hearing me clearly, because that's where we have trouble. So if your family's telling you, don't think they're just beating you up. They care about you, they want to communicate clearly with you, and they don't want to keep shouting and repeating themselves. So that's how you know you need it.
When I come for a test, should I bring anyone or anything with me?
Oh, that's a great question. A lot of people want to come by themselves. One, they know what I'm going to tell them, but it's really a disservice. My voice, I speak loud and clear and distinct. I'm trained to do this. Everyone in my profession, we are. We're not the voice that you're having trouble with. It's a loved one. It's a wife. It's a daughter. It's a son. It's a friend. It's important for them to come in, because if we do a demonstration of hearing aids, I want you to hear their voice better or not my voice. Especially if, say, they speak with an accent, or they speak low, or they speak high. That's the voice I care about, not really mine, because I don't live with you, unless you invite me to live with you. But that's important. Also, we give over a lot of information. This is brand new for a lot of people. 4 ears are better than 2, to remember. I heard a study one time that's humbling, that most people will remember 25% of the things I say by the end of the day. By tomorrow, it'll be 10%. And I joke, I hope that 2 people here remember different things. But it's very important to have someone else come in, and also to give some background. Yeah, it's been about 10 years since he hasn't heard clearly, because the person coming in may say, well, it's been about a year or 2. So it's very important to have someone come in with you who's engaging for the appointment.
What is the difference between a hearing aid and an amplifier?
Excellent. A lot of things you see advertised on the internet, on TV, and they say for $300 you can hear better. They're basically amplifiers. Amplifiers are what hearing aids used to be about 16 years ago, 20 years ago. They just make things louder. But as we know, when you make things louder, they don't come clearer. The analogy I use is a radio that's staticky. When it's staticky, you turn up the volume, it just was louder static. We need the clarity, we need the equalizer. So what a digital hearing aid is today is they're an equalizer that takes the lows down when there's background noise and brings up the highs for speech. A lot of the ones that say they're hearing aids, if you read carefully, it will say they're an amplifier.
What kind of new technology is available with with newer hearing aids?
It's incredible. Again, I mentioned earlier, light years from what it was. The processor is so much faster. There's millions of adjustments per second that's happening simultaneously. As you enter one environment, like a restaurant, it's automatically going to be lowering the background noise and bring up speech. Now I change and go to the parking lot, it's going to lower the road noise and bring up the speech. Again, that's what it's always doing. But what about outside, in the outside environment? Well, guess what? It's going to bring up some of the ambient noise, because I want to hear the trees rustling. I want to hear the birds chirping and the crickets. So it's always adjusting as you're entering different environments. But new technology, especially since COVID, is they're all Bluetooth compatible now. And there's an app on the phone, which you don't have to use. But what's nice about it is you can control the hearing aid a little bit on your own. And if you can't come into my office, or if you go to Florida and you having trouble with any troubleshooting, we remotely can log in through your phone and help you there. So you're not tied to the office. You can travel and still know that someone's at your beck and call whenever you need them.
And why do people not like to wear hearing aids?
Going back again, the people who are fitted properly and get the hearing aids that are good for their lifestyle love them. The people who don't like them are ones who got less expensive ones that don't fit their lifestyle. They also don't like the servicing. Places like us, we provide great customer care. That's very important. If you get an inexpensive hearing aid and the customer service is lacking, well, you're not going to like the hearing aids, because they may need an adjustment, they may need a cleaning, or you just may need a hand holding. What's going on? I had trouble with my daughter's recital. Things like that, and that's why a lot of people don't like it. When people come to me with hearing aids from some other place, usually is they got less expensive ones but didn't fit their lifestyle. That's vital. You get the ones that fit your lifestyle and you'll be very happy.
Can you touch on any of the medical conditions associated with hearing loss?
Well, we mentioned that before, that you have certain kidney failure, heart disease, smokers, that affects the nerves in the ear, in the cochlea. They're very sensitive. Everyone's different. But again, if you have hearing loss and don't treat it, now you do yourself a disservice in the auditory cortex, part of the brain, that's processing speech, memory, understanding, and it leads to other issues, balance issues. So it's very important. Money's being thrown at Alzheimer's and dementia research left and right. Well, not to say again this is a cure for it, but it really helps get ability. One story, I had a man who had severe Alzheimer's, didn't speak clearly for 5 years. He came to the office, we put a hearing aid on as a demonstration, and his voice cleared up, and his son started crying and said, "Oh my God, I haven't heard him speak clearly." Well, he wasn't slurring because of the cognitive decline. He was slurring because he wasn't hearing himself clearly. We speak as we hear. So once you put the hearing aid on, he was speaking clearly again. It was very, again, an emotional thing. That's why I love doing what I do. And I'm glad I made this career choice many years ago, because we affected that life. Does the man's dementia get better? I don't know. He still was in a really tough situation. But now his kids could understand what he was saying without thinking, oh, it's just a dementia, Alzheimer's. I'm trying to think of anything else. But now, we have a booth. Some people say, well, how do you test my hearing? Some places do it on their desk, but we have a full audiological booth here. I often joke it's the size that I can rent it out as an Airbnb on the weekends. We also can do testing. If you're wearing hearing aids, we put sound, and it's called sound field testing. I can test how you're hearing with the hearing aids on. And that's very important for some professions. Truck drivers, crossing guards require that. It's a soundproof booth. You don't hear anything where you're in there. And then I'm over here at this desk where I present tones, beeps at different volume, and ask you to respond by raising your hand or pushing a button. And it takes, again, about 15 minutes. I read words to you. Hear the words I read. Don't memorize them, but this is what I'm going to see how well you're responding to what I'm saying. And like I said, the whole appointment takes about 15-20 minutes for the test, and then the explanation and demonstration takes probably another 15-20 minutes. You know, we don't rush anything. No, you should never feel pressure to rush to make any decision. Everything in its right time and place. I'm just looking. Anything else? The styles is what has been changed in the last many years. But the most important thing is get that free baseline hearing test. Call one of our centers. Call. You know, I don't know about the links below, but I'm sure there'll be links below telling you how to contact one of our centers for a free hearing evaluation. Any other questions coming in? I'll talk about safe topics. You know, write me anything about politics, religion, and sports. Only joking. I don't touch upon those. But, you know, talk to your friends and family about it. Look forward to helping you, and one of my colleagues helping you. All right?